Can you tell the clear-cut difference when you see a mental health issue as well as a spiritual issue? Can you differentiate a medical issue from a spiritual issue? When do you tell exactly that a spiritual issue is what is affecting an individual? And when can you actually know that this is not a spiritual issue, rather it's a mental health related issue? So that's the reason for avenues such as this, of which we tend to create health awareness, more specifically mental health related awareness. And that's why for this very video, we're going to be talking about the aspect of when an individual would be needing hospitalization for a mental health related issue. Although we're also going to be making a video on those various criteria where one can be said to be mentally well, or when one could be said to be mentally unfit or unwell. So, without making further ado, let's discuss on those various factors that are determinant for hospitalization of substance abusers. So, a couple of persons would find their client or patient having issues with substance abuse, and they are contemplating, should we seek for a rehabilitation, or we can manage this client as outpatient basis, or we can manage the client at home, in the sense that without going to a rehab center. And then at some cases, some persons feel the right place to take their clients to when they have mental health related challenges is to take them to prayer homes or to the church or spiritual homes. And so therefore, they end up bringing up these clients or presenting them in the later phase where complications have actually set in, or when it is almost difficult for one to expect the possibility of a recovery. So, what are those determinants? The determinants for hospitalization of substance users can be broadly categorized into the medical, psychological, social, environmental, and other factors. So, here are some of those key factors that are major players or determinants of one requiring an hospitalization due to substance addiction. All right. So remember, we have made a video on an addiction, of which we categorize addiction into several dimensions and realm. And then we also stated that among one of those type of addiction, we have substance abuse. So in this very video, it is specifically for those persons suffering with substance abuse, although can be applicable to some extent for those persons suffering with addiction. So the first one is the medical factor. Where there is severity of addiction, patient with severe addiction, withdrawal symptoms or medical complication may require hospitalization. What do we mean? What are withdrawal symptoms? We said that withdrawal are the symptoms an individual will actually face when he or she is off those substances that they have been taking or abusing. So those symptoms will actually present themselves to show the absence of that particular substance. So where there is a withdrawal symptom that is severe in nature, or other medical complications such as hepatitis and so on, it may require one to be hospitalized so that a comprehensive care and management could be given to this particular client. Co-occurring medical conditions could also require hospitalization. The presence of chronic medical conditions such as liver diseases, heart diseases, as well as HIV and AIDS would require one to be managed because they are one, the presence of the medical condition, and then the presence of the substance use disorder. Remember, in one of our videos, we talked about the aspect of single diagnosis, dual diagnosis, as well as multiple diagnosis. Single diagnosis means the patient have just one condition, either it is medical in nature, or it is mental health related in nature, or it is actually other forms of illnesses. Okay, so for this case, we are actually inferring that the client has the presence of a medical condition as well as the substance addiction. Okay, so this client will require hospitalization for attention to be given for the substance use as well as for the medical condition. Then, where there is overdose or poisoning, there's what we call drug intoxication, where an individual take increasing number of or increasing amount of substance of which it is actually lethal or sufficient enough to be called the poison dose or the intoxicating dose. Okay, so what are we saying in essence? Acute overdose or poisoning requires immediate hospitalization so that substances such as antidotes or neutralizers can be given to neutralize the effect of this particular substance that they actually ingested or they administered on themselves. Then when there are withdrawal symptoms, severe withdrawal symptoms such as seizures, delirium treatment could actually require hospitalization. And then we have the second determinant called the psychological factors. All right. One is the presence of mental health disorders. Where there are co-occurring mental health conditions such as depression, anxiety, or psychosis, there will be need for this individual to be hospitalized. If you can still recall, I talked about dual diagnosis and multiple diagnosis. So I said that in a single diagnosis, the patient have just substance issue. And then in a dual diagnosis, there's substance issue as well as a medical issue or a mental illness. And then in multiple diagnosis, the presence of the three. All right. So where there is the co-occurring mental health conditions such as depression, anxiety, as well as psychosis, there will be need for this client to be hospitalized. And then secondly, where there are suicidal ideation, patients with suicidal thoughts or behaviors will require hospitalization so that they don't get to harm themselves where there is no observation, whether obtrusively or non-obtrusively. All right. So where there are also cognitive impairment, people suffering severe cognitive impairment such as memory loss as well as confusion will require hospitalization so that harmful environment or environment free of harmful objects or substances can be maintained. Hence, to also bring back the client or to the point where the client gets his or her awareness as well as can make proper and good judgment. And then emotional instability could be a psychological factor or determinant that would warrant hospitalization. Patients with severe emotional instability or behavioral disturbances will require hospitalization. There is what we call mental and behavioral disorder, where the individual is having a mental health issue of which behavioral wise is actually manifesting abnormal behavior or bizarre behavior. This client will require hospitalization. And then we have the third determinant, which is the social aspect. There are some social factors that will determine if a patient should be admitted or not. One of it is lack of social support. Patients without a supportive family or social network may require hospitalization. What do we mean? We mean patients where their support network in terms of friends, family, and loved ones are actually reduced. Those patients would require hospitalization because there will not be sufficient observation of this client as well as sufficient support to this client to ensure that the recovery journey would actually be a smooth one. So, what are we saying? Patients that have reduced or no support network would require hospitalization. Secondly, homeless patient would also require hospitalization due to lack of stable living environment. And that's why upon discharge, one of those factors that we consider is the environment for which the patient is to be discharged into. All right. Unstable living environment could also be a trigger to this patient. Hence, patient with living in environment that trigger or enable the substance use would actually require hospitalization. And then family dynamics could be another social factor or determinant to look into. Persons from dysfunctional family dynamics that contribute to substance abuse will require hospitalization. The next one is the aspect of the environmental factors. Certain environmental factor will determine if a client actually require hospitalization or not. An instance is access to treatment. Availability and accessibility of hospital-based treatment program would be a greater determinant for either the need for clients to be admitted in terms of inpatient care or to be managed on outpatient basis. And then insurance coverage will be another environmental factor to actually put in perspective. Patients with insurance coverage may be more likely to be hospitalized because financially there is that coverage for them. And then legal issues, it's another environmental factor to consider. Court-ordered treatment or incarceration may require hospitalization. Persons who have either committed or homicide in the sense that the taking of life of other persons, either it is intentional in terms of murder, where there are actually the issue with jealousy or a pre-issue before time, may want to fake that they have mental health issue and then take the life of another person. Those set of persons may require hospitalization due to incarceration or court order, all right? Or those persons who unintentionally, due to the use of their substance, actually hurt persons may also require hospitalization due to legal issues, all right? Then we have the next one, which is community resources. Availability of community resources such as detoxification centers or rehabilitation program would actually enhance the possibility of hospitalization. Other factors we need to consider are the age range of these persons. That's why we have homes for child rehabilitation, all right? Persons within the younger person or juvenile age, their own set of hospitalization is different, all right? As well as those persons who are actually from their youth to the adulthood, those persons, their type of hospitalization also differs. Okay, so what are we saying in essence? Older adults or adolescents may require hospitalization due to unique needs and vulnerabilities of these persons. All right, vulnerabilities for the elderly may be in terms of cognitive impairment or memory loss, as well as that of the younger persons may be the presence of their triggers, so they may require hospitalization. And then pregnancy. Pregnant women with substance use disorder may require hospitalization so that they don't get to hurt themselves or the fetus. Then, history of trauma. Patients with a history of trauma may require hospitalization. Persons, for instance, that have past memories, the flashbacks can even push them to become suicidal in nature. Hence, they will require hospitalization. And then, treatment resistance. This comes to play in patients who have failed outpatient treatment or have a history of relapse. So those persons that have failed outpatient treatment would require hospitalization because in managing mental health related issue, there are several options. For instance, we have the inpatient and then we have the outpatient basis. We also have the online or real-time management. So if the outpatient basis fails, then they will require the inpatient hospitalization. And then where there is relapse also, there may be need for hospitalization. So in general, we are saying that various factors are considered when assessing the need for hospitalization, but the specific criteria may vary depending on the healthcare provider, the treatment center, as well as insurance requirement. So if this very video is actually useful to you, I would like you to actually give this very video a thumbs up at this very point. And then if you are yet to subscribe, please click that subscribe button below and then turn on all notifications so that when videos like this drop, you actually be among the first persons to actually be notified. And I also look forward to that very moment where this very channel becomes your most favorite click. Thank you so much for coming this far. I appreciate you. Please check back because there are other videos you would also benefit from, such as those factors that will determine the duration of hospitalization of persons with substance use disorder, as well as those factors that should be considered before terminating the hospitalization of substance user. All those criteria you need to actually check or to know if one actually have a mental health related issue or not. So for now, stay safe and see you next time.